Good afternoon and welcome to Seminar 1 of 7 from the IHP in partnership with Queensland Health. I am RN Jaden. I'm currently working near Weipa in far north Queensland. I'll start off by welcoming all of those who are new to working in rural Queensland. The aim of the seminar is to educate you on 7 different preventable conditions which are prevalent in Aboriginal and Torres Strait Islander people. You will be speaking to 4 of my fellow co-presenters. Today we will be talking about renal disease. First off, just some facts. Renal disease plays a part in all of these facts and figures. This is why the Queensland Health has teamed up with the IHP in creating these seminars to give you all more information. So what is renal disease? Renal disease refers to when the kidneys have become damaged and lose the ability to function adequately. If you look down at the pamphlets handed out to you, you can see the structure of the kidneys. The function of the kidneys is to filter the blood, to regulate and remove minerals and waste materials from food, medications and toxic substances. They also maintain overall fluid balance and have a role in regulating blood pressure. The parts of the kidneys which act as the filters are called nephrons, as you can see on screen right now. It is when these structures are damaged that kidney function is impaired and renal disease occurs. Renal disease may be treated, but it is common for cases of renal disease to remain undetected until serious damage has been caused. This is because renal disease may show few or no symptoms until the kidney has lost almost all function. Renal damage and dysfunction have various causes, such as kidney stones, glomerulonephritis, which is inflammation of the glomeruli, urinary tract infection, kidney cancer, hypertension, and diabetes, which is the leading cause of renal disease. Diabetes is a cause of renal disease because the high glucose levels of blood damage the nephrons. Hypertension, which is a cause of damage to the nephrons, may become worsened by kidney disease as the body cannot remove waste and fluid from the body, resulting in a cycle of disease processes. Chronic renal disease is a prevalent health problem in Indigenous Australians. It has been found that they are 4 times more likely to develop end-stage renal disease in comparison to non-Indigenous people, but these rates may be as high as 20 times more in rural and remote areas. The reason why this is so important is because approximately 50% of the proportion of Indigenous Australians suffering from end-stage renal disease live in regions without access to dialysis facilities. It has been found that Aboriginal babies have an increased risk of being born with fewer nephrons than non-Aboriginal babies, predisposing them to a higher risk of renal dysfunction. Early detection and treatment may assist in reducing the progression of renal disease to renal failure. Testing for protein in the urine and calculating the glomerular filtration rate, which determines how much function the kidneys have, are used to make a diagnosis of renal disease. This is where we come in and why Queensland Health is working in partnership with us to make this seminar. We can really make the difference. To do so, we have to know the signs and symptoms.
Renal disease, as mentioned by Jaden, displays few symptoms before it is too late, making it integral for us to be able to catch it early or at any sign of incline. On page 2 of the pamphlet, we have placed some of the changes you could see due to the kidneys failing, signs such as the change in vital signs with blood pressure rising and the shortness of breath. The key aspect of monitoring renal disease is the kidneys, looking specifically at the changes in the amount and number of times urine passes, changes in appearance of urine, blood and urine. Signs of physical pain can also be associated with renal disease, such things as puffiness in the legs, ankles or around the eyes, pain in the kidney area, muscle cramps, pins and needles in your fingers or toes. The patient may also experience bad breath and a metallic taste in your mouth, headaches, lack of concentration, tiredness, and in severe situations, nausea and vomiting, loss of appetite, difficulty sleeping. We are aware that several of these symptoms are pretty general and may be caused by other diseases, but if they are related to kidney disease, may worsen as renal function declines. The biggest focus for us is the changes in urine. So who is the most at risk and what are some factors that can cause chronic kidney disease? Please refer to the pamphlet once again. Diabetes is one of the most common causes of chronic kidney disease. According to Diabetes Australia, Aboriginal and Torres Strait Islander people are almost 4 times more likely than non-Indigenous Australians to have diabetes. 11% of Indigenous adults have diabetes. High blood pressure causes damage to the blood vessels in the kidneys, prohibiting the kidneys from performing their function efficiently. This results in protein being leaked into the urine. High blood pressure damages the blood vessels that are important in filtering the essential oxygen and nutrients needed for the body. 20% of Indigenous adults have high blood pressure. High blood pressure is the second leading cause of kidney failure. Over time, blood pressure causes the arteries around the kidneys to narrow, weaken or harden. Once they are damaged, they are no longer able to deliver sufficient blood to kidney tissue. Almost 1 in 5 Aboriginal and Torres Strait Islander people had indicators of chronic kidney disease. Having a family history of end-stage kidney disease or hereditary kidney disease in a first or second degree relative. After adjusting for age differences, Aboriginal and Torres Strait Islander people are more than twice as likely as non-Indigenous people to have indicators of chronic kidney disease. Here are my colleagues Ben and Silas to talk about strategies.
4 strategies that help to reduce Australian Indigenous people's health inequalities are: firstly, Kidney Health Australia is a not-for-profit organisation dedicated to helping people with kidney disease. They play a vital role in closing the gap in health outcomes for Indigenous and Torres Strait Islander people. When working in a rural setting, we promote the use of Kidney Health Australia's Chronic Kidney Disease Determination Quiz. This quiz is a series of 12 simple questions to gauge the likelihood of a person acquiring chronic kidney disease. For rural healthcare workers, often short-staffed, this quiz is a great way of retrieving patient information on a large scale with minimal effort. This allows us to focus our resources to those in remote Aboriginal communities that need it most. We have given out posters with more information about Kidney Australia and what they do. Secondly, Queensland Health decided to focus their attention on diabetes in rural and remote communities. They did so by creating a My Nutrition Strategy information poster, which has information on weight control, healthy eating, and alcohol and artificial sweeteners. This information poster looks to tackle the issue of kidney disease through the education of diabetes and how to control it. Rural and remote settings, having this information easy to access makes educating the population more efficient. This offers an insight into nutrition only nutritionists can provide. Being rural limits the important access to those with extensive nutrition knowledge. This information poster aids in closing the gap between rural Indigenous communities and the rest of Australia. Queensland Health furthermore turned their focus specifically towards training health professionals to be better equipped with knowledge in regards to blood pressure, as this is the second biggest contributing factor towards chronic kidney disease. It is imperative that health professionals have the ability to interpret, understand and utilise the blood pressure information obtained. Queensland Health provides a detailed clinical task instructions sheet with step-by-step instruction when obtaining blood pressure. The sheet focuses on safety and equality and interpretation of results. In regards to kidney disease, understanding the changes and differences in blood pressure helps to prevent the fatal results. Although this is knowledge health professionals learn, it is important that these skills are kept updated. Queensland Health is taking great measures in closing the gap in Indigenous health.
Finally, the National Rural Health Alliance represents 36 national organisations working together to improve the health and well-being of Indigenous people in the rural and remote communities of Australia. Strategies they're trying to improve in the rural community of Australians is improving the variety of dialysis options. This includes providing home dialysis and improving access to dialysis units. A problem rural and remote communities face is that most dialysis are not easy to access. Providing dialysis units that are at home is pivotal to improving the health and the equity of Indigenous Australians. The National Rural Health Alliance understands that peritoneal dialysis is already commonly used in rural areas. A significant barrier is water quality and quantity. The National Rural Health Alliance believe these obstacles can be overcome with the appropriate planning, funding and resources. This tertiary prevention will save lives.
So what are our roles as nurses in order to help close the gap in regards to renal disease? There are 3 stages of prevention that we as nurses focus on infiltrating and making a difference. The first is primary intervention. Primary intervention seeks to halt and stop the disease before any evidence or symptoms have occurred. Primary prevention may be aimed at individuals or at the communities. As nurses, our roles as patient advocates is to determine the best way of encouraging and making a change. In regards to renal disease, as you learnt from the seminar, many of the Australian Indigenous population are doomed at birth by either having low birth weight or their bodies not creating enough nephrons. As a rural community nurse, it is integral that we promote and educate pregnant mothers in the importance of their health and how it affects the baby's condition. This education could lead to a shortening of the gap between low baby weights and improving the change of renal disease. We as rural nurses are to provide this education through the many strategies available. For example, the My Nutrition program mentioned by Nurse Ben. The secondary prevention is catching the disease early, which means it can be slowed or even reversed. As a nurse, in order to catch renal disease early, we have to be aware and have full understanding of what may show signs. Mentioned by Dr. Scott, urinalysis is one of the best ways of detecting early on if the renal system is functioning well, along with monitoring blood pressure. As mentioned by Nurse Ben in the strategies, there are several Queensland health guidelines available to follow for both urinalysis and blood pressure readings. The way we can help as rural nurses is being competent in those skills and testing required to detect renal disease.
As health professionals, we would love to detect and assist with diseases in the primary and secondary stage. Tertiary prevention is one of the final and last resorts. At this point, renal disease is in full motion, and at this stage, we are trying to minimize the negative consequences of renal disease. We do this in order to reduce disability and handicap, to minimize suffering for the patient, and we do this to promote the patient's understanding and adjustment to the disease. This is the area in which renal dialysis is undertaken. There are many of you who are specializing in renal dialysis, and you guys are the tertiary prevention. Our roles in the position is to provide the best care possible for our patients. As rural nurses, we must closely follow the steps and strategies provided to us. Our goal is to close the gap between Indigenous and non-Indigenous Australians. This can be achieved through education and working together. We, at the Indigenous Health Program, believe we can make a grave difference in those in the rural communities. We are all excited for your rural journey, and we thank you for choosing rural health.